they have allowed the families to come in and be with their loved one in those final hours or final days. And I just want to commend them for that, because, we talk about doing things, and rightfully so, to prevent the spread of the coronavirus. But sometimes when you do certain things, those have impacts in other areas, particularly things like mental health and these types of family connections. And so I think Advent, they recognize that this was a really, really big deal for families in very, very difficult times, and they decided to make that accommodation. And I think that's been a big relief to a lot of families to be able to have that very, very intimate connection during a very, very difficult time. So thank you for doing that. I think it's the right thing to do, and we've encouraged other hospitals to follow suit. So it's an honor to be here. I want to allow some of the folks here to be able to weigh in on the things that they're doing to generate better patient outcomes. I mean, we hear a lot about a case or a positive test, but what about the recoveries? And this is really, I think, a story that has been positive, and it really reflects the high level of professionalism that we see throughout many medical systems in the state of Florida. So, Dr. Oliveira, do you want to talk about some of the things that you've done, how you've seen outcomes improve, and because I think you had a lot of good things to say in our roundtable.
Sure. First, I want to thank the organization for providing the support to our ICUs. I think that part of how we did well on our outcomes has to do with us being properly staffed, having the proper PPE throughout this pandemic. We've used a variety of treatment options from the early days, including corticosteroids, remdesivir, convalescent plasma. But I think a big thanks and a big credit needs to be given to the staff. So our staff has done a tremendous job in our ICUs and our hospitals, our intensivists, our hospitalists, our nurses, our respiratory therapists. It's truly a team effort. Many of those patients stay in the ICU for many days. Sometimes up to 100 providers end up seeing those patients and taking care of them and participating on their recovery. We are glad to see that our mortality is below national average. We've been around 25% on our patients that are mechanically ventilated, which I like to talk about survival. Their survival is 75%, which is terrific, compared to what it was and what it's been in some other locations. But of the patients that get hospitalized, 5% or 95% of them will survive. 5% of them will expire. So I think that's although it's never a positive to have anyone succumb to this illness, I think that we've seen improved outcomes over time. And I think it has to do a lot with the team approach, us not being overwhelmed, preparing ourselves, having cohort units, standardized care as much as possible, and protecting our community. I think I'm proud of the outcomes. I think we've seen something special here in Central Florida with the hospitals here that participated together in attacking this pandemic the right way.
You talked about the recovery rate compared to some other, can you put that in perspective? I mean, some of the early days, what were some of the recovery rates for ICU or mechanical ventilation?
Sure. If you look at early Italy numbers or what happened in New York, and obviously different situation, hospitals got overwhelmed, but the survival rate was only around 15 to 20% in some locations, with a mortality rate of about 80%, 50%. They varied around those numbers. We don't know all the factors that played onto it or in this high level of mortality. We also don't know we have all the answers of why we did so much better, but that's the perspective that we look into.
And the tools that you're using, whether it's the convalescent plasma, the remdesivir, obviously that wasn't available to folks in February or March.
Exactly. And there were a lot of things that we've learned over time in caring for those patients. And that's important to learn during this process is key. And to gather those things that we've seen have worked in other places, have worked around the world, and implement them as quickly and as universally as possible. So I think that, yes, we have to put that into perspective as well. Time has allowed us to be better at it, no doubt about it.
Oh, great, thank you. Dr. Hsu, can you talk about some of the things that you've been seeing and trends, some of the other things that you think may be important?
Yeah, so on the hospital census side, we have seen a steady but very consistent decline in our census. For the Central Florida region, for our hospitals, we peaked at 515, and this was on July 19th, and now we're just at 406. So we've seen a significant drop over the last couple of weeks, and for all our Advent Health hospitals throughout the state, we were at 946 and now down to 815. So it's really clearly a testament to what's been done. Part of it, of course, has been fewer admissions, and Dr. Mansfield may talk about this more in detail, but there has been a greater ability to learn and to take patients that would normally be admitted and actually be able to monitor them at home. And again, we've always been learning, as Dr. Oliveira said, on how to treat patients, so we're much better at getting these patients quicker, and discharging from the hospital. So we hope that these trends will continue.
Did you, have you noticed some other places in Florida said that the admissions in March and April skewed a little older than the admissions have in late June and July? Is that consistent here?
Yeah, the admissions in June have skewed a little bit younger than they were in the first part of the pandemic, but generally our admissions tend to be older than those that are diagnosed, because the ones that are admitted tend to be a little bit older. And we have seen a little bit of skewing of ages, and of course this is very dependent upon the locality as well. Orange County, Orlando, we've generally seen a younger population overall compared to some other areas.
And then what are the major comorbidities that are leading for some of the patients to end up admitted and then maybe end up in intensive care?
Yeah, so I mean, obviously, age is a huge factor. Of course, nothing that can be done about that. But other comorbidities include the usual things that we see a lot. They will include hypertension, diabetes, those that are immunocompromised, for example, cancer therapies and so forth. Obesity appears to be one of those factors as well that really plays a role. So certainly, any disorders of the immune system can certainly lead to more complications.
Great. Well, thank you, Dr. Mansfield. Thank you. How has it been at the ED? I mean, I know it's very busy. I know you guys got a lot of people that are working really, really hard. How are people holding up? And what else do you think is important for people to know?
So I'm very proud of the emergency department team that we have, both the physicians and the nursing staff. I think we are the definition of a resilient group of people who've been able to adapt quickly to change. What we're seeing is we've seen continued numbers, but as Dr. Hsu pointed out, we are able to safely discharge patients, even those that a few months ago we probably never would have done that, but we've been able to set up televisits through our home monitoring agents using smartphones, really leveraging technology. What I also seen, though, and Dr. Oliveira could probably speak to this as well, has been patients delaying accessing care out of fear. And that's very worrisome because COVID, while extremely important and relevant.
So that's non-COVID patients.
Yeah. And so patients who have other medical problems that they're delaying care, things that would normally have you end up in the emergency department, such as chest pain concerning for heart attacks, stroke-like symptoms. And I understand it. There is a fear, there's an uncertainty, but unfortunately we're seeing some patients with worsening outcomes as a result of that fear and that delay in care, and ultimately ending up needing critical care management as well.
So you saw this in March and April, like everyone else, the decline in heart and stroke coming to the ED?
Coming in and then coming in, unfortunately, very late beyond where we
could
get
therapy. So we kind of had March, beginning of April. Obviously, there was a lot of fear in the air. As April went on, it subsided a little bit. Did you start to see the ED visits get back to normal in May?
We have not yet normalized.
So you still haven't normalized?
Correct. And when we see these patients, we're still seeing delayed presentations.
Oh, wow. So, so you probably have non-COVID patients in ICUs today who may not have been there had had they gotten the care when they needed.
Absolutely. And so the message we just want to consistently give is that, again, COVID is a very relevant conversation to have. But as a result of COVID, we've simply just had to change the way that we practice and make sure that the environment that we have for our patients is one that's conducive, it's safe. And that's why you'll see all these extra screening initiatives that we have, the masking that we'll ask all patients to have, temperature checks at the door, all the things that have really become now commonplace in our community, even more so though in the hospital setting, just to make sure that people understand that despite COVID, we'll still be able to provide safe care, and we really would like it to be timely rather than delayed.
No, I think it's this is one of the biggest problems that came out of March, April, and then now was people not feeling comfortable going to the hospital, particularly for heart or stroke, which are, I mean, those are huge, huge contributors to mortality every year. And they've waited, the conditions have gotten worse. And part of it, I think, and to the extent this is still happening, there's a fear that they may catch coronavirus here, but this is one of the safest places you can be. I mean, they have all this stuff. They know what they're doing. The COVID patients are isolated, negative pressure, all this. So they know what they're doing to be able to do that. So that is not a significant risk to come in for that you're going to catch it. There's also folks that have thought, I think in March and April, and then maybe even now that, well, the hospital doesn't have room for me because I'm reading that they're overflowing. That's not true. There's space here. Orange County has got a lot of bed space available. And don't forget, the percentage of patients in a hospital that are COVID, that's just one fraction. They have many more patients who are in for all kinds of other things. And so you can feel comfortable that they're going to have a place for you. They're going to be able to treat you, particularly for those really significant symptoms. And so I think that is something that we've delivered that message time and time again. But I mean, the numbers are jarring if you look at the drop that happened in March and April. And it's like, in the middle of April, it's like, a lot of these hospitals were running at like 50% capacity, and the ED visits were way down. And so that's not healthy. We want everybody to get care, and they're here. They're going to be here to help you if you need that. All right, Lynette Johnson, Chief Nursing Officer, talk to us about how you guys have been helping. Obviously, this is a stressful time. It's very, very difficult. People are working very, very hard. We appreciate that for sure. So how are you guys managing, and what else are you seeing?
Thank you, Governor. Appreciate that. I think really what we're seeing is you've heard us talk about, and you've heard that staff are tired. Nurses are tired. As a company, we've made a big investment into supporting our teams, our nurses, and investing in them just as we do for our patients. We've actually know that while we're plateauing, we continue to make sure that we have the adequate resources that we need for our teams and for the community. As a national company, we've actually brought nurses from Advent Health across the country here to actually help us in Central Florida and give our staff some respite. Some of the things that we've seen, of course, is trying to care for each other and making sure that it's a really good working environment. Our teams also are becoming families for our patients. You talked a little bit about how COVID is a lonely disease, and some of the things that we've identified is that nurses and frontline team members are wonderful people to fill in those gaps. They don't just come in to do, clock in and do a job. They're actually bringing their hearts with them. They're celebrating birthdays, anniversaries, milestones with patients. Our nurses and frontline teams have actually facilitated what we call virtual compassion visits. So for those patients whose families can't come, they're far away, or they just cannot get to the organization, we do virtual visits where they can visit with their loved ones. And really because we believe that human connection is part of healing and part of comfort. So really just thanking our teams for that love that they bring every day. I'm a firm believer that it takes people caring for people to be able to see us through this pandemic. And I think that's not just our nurses, it's our frontline teams, our physicians, and our community out there social distancing and wearing masks to keep us all safe.
How is the staff in terms of the prevalence of coronavirus amongst the staff? I think March and April we didn't have very many staff statewide that were testing positive. I mean, we had some, but as it was more rapid in the community at the end of June and July particularly, have you then seen more staff, more nurses testing positive because of exposure in the community?
We've actually just seen plateau, and many times it's just we self-isolate. So if you've had a risk and an exposure, we follow CDC recommendations, and we have you stay at home and then follow up.
Yeah. And Dr. Hugh, can you talk about your testing here and kind of the tools that you're using as someone that come to the ED, or are you testing everybody that comes in for things unrelated to COVID, like if someone gets in a car accident, are they being swabbed, as they're being cared for as well?
Yeah, initially we were able to, when the cases were low, we were able to test everyone for COVID, whether or not they were suspected of having COVID. That has been a lot more challenging now just because of the sheer numbers of cases. But we have really worked hard to try to increase the inpatient test availability that we have. We can do several hundred now inpatient and get those results quick. For the other ones, we have to send that out. And it's not just the PCR test that we have available now. We have other types of rapid tests. They're known as antigen tests that allow really quick diagnosis in about 15 minutes. In certain situations, it's pretty comparable to PCR testing. It's another strategy that we are using in the outpatient clinics, in the emergency departments to help diagnose as well. And we have more availability for that to be able to get a quicker diagnosis.
Yeah, one of the things that we're going to be putting out guidance on the state in terms of some of this testing, particularly for employees, is in CDC, they put out some guidance on Friday about symptom-based approach to clearing people to go back to work, because what happens is if you require a negative PCR test in order to go back to work, according to CDC, now we knew that could catch dead virus for a decent amount of time. CDC said that could be up to 12 weeks, where an infection could be 12 weeks old. Obviously, you're no longer infectious. You don't have live virus, but it can pick up some of the dead virus in a PCR test. So that obviously is not something that that should keep someone out of work. And so going to a symptoms-based approach, particularly for a lot of the the employers, that is going to be a better way to do it. We're going to have to tweak some of our guidance, because when we went into the phase one, I mean, we did obviously for restaurants and stuff, like the facial covering, some of this stuff, but we did have requirement of PCR test negative to come back. We're going to move that to a symptom-based approach. So if you don't have symptoms for a certain number of days, then you're going to be fine, because they've learned more about how long someone is actually going to be transmitting this virus, and it's not 21 days. Another thing we're also trying to get better at is we're working on these symptomatic lanes at some of our test centers. We've gotten much better turnaround time with those, because the people that have symptoms are really the ones that we want to be able to get the test results to for obvious reasons, but also the asymptomatic people. You test positive and you're asymptomatic. If you can pop for 12 weeks, we can't even be sure at that moment that you're testing that you have a live virus. Even if you did have a live virus, if it takes a week to get the test result back, you ain't going to be live at that point. So isolating you and contact tracing is not going to be terribly effective. So these are things that I think we're working through, but I definitely think continuing to focus on getting our symptomatic Floridians the ability to go in, get a test, and get a quick result. Obviously, if they're going through a hospital where you have point-of-care testing, that's a little bit different. Our testing at our drive-through sites, we do have to send out to labs to be able to do it, but I think we found where we can definitely accommodate, many of the symptomatic people with a pretty decent turnaround time. So we're working on that as well. I want to thank the folks here, at Advent. This is just so important to be able to be on the front lines. This has not been easy because, one, in March, as this thing came to a head, this was such an unknown thing. There was shortage of PPE, all this other stuff. We kind of went through. We had some quiet time at the end of April, March, and beginning of June comparative. But they were still working hard. They were still ready to go. Had to do the same procedures, everything. And then now, as you saw, testing increase. You saw positives increase, more admissions. Now, fortunately, we've stabilized on that, and we have seen declines. We want to continue to see those trends, but people have had to work awfully hard, and this is a very I would say labor-intensive illness to deal with would probably be a good way, because you have to isolate, you have to do all these things, and so all the frontline workers, have just done a heck of a job, and so my hat's off to you. We're here at the state to support. I mean, our four main objectives and plan from the beginning, were one, protect our vulnerable, particularly our elderly and our long-term care facilities. Two, expand testing, which we've obviously done because we're getting almost 100,000 results a day. Three, practicing adequate social distancing. And then four, support our healthcare workers and our hospitals. And so when there's a need for things like remdesivir, I'm going to be very active in making sure that continues to flow. We're going to help with trying to drive more support for convalescent plasma. As there's other things that come up with personnel, we're happy to dispatch personnel to some of the areas that have a need. And so we're here every step of the way, because we understand that when we're empowering them to do their jobs better, the recoveries are better, the patient outcomes are better. And really, it's all about doing everything we can to save lives. So thank you for having me, and thank you guys for all your hard work over these many, many months. Take some questions.
Hey, Governor, today 186 deaths reported, and we've had new records set for family. How do you square those numbers with the message today that things are stabilizing, the virus is stabilizing?
Well, one, I would just say, these are tough things to see when you see, fatalities come in. We have obviously, we're working hard to protect the long-term care facilities. I mean, we still have, fatalities related to long-term care, and then obviously to have, families lose somebody is a big deal, and every one of that matters. I'm glad Advent is allowing that final connection, because I think that can really mean a lot for the families for the rest of their lives. But what I would say is, if someone's admitted to the hospital today, there's going to be a certain amount of treatment and everything. And so these things, usually it results in discharges, as we've heard, but, not every time. And so I think when you see those reports, those are probably reflective of infections and hospitalizations that have happened in the past, and that's just so it's more of a lagging indicator, whereas I think the ED visits and some of the hospital censuses is probably more of a leading indicator about where things are trending. And so as you have fewer ED visits, as you have fewer COVID positive patients in the hospital, we think, and I'm pretty sure with what the good work they're doing, you'll see mortality decrease as well. And obviously we want to get there.
Are you going to extend the eviction moratorium? That would be last 2 weeks.
We might, yeah. We'll have an announcement on that soon.
Governor,
Yes.
I'm curious, when is the last time you've been tested for COVID, and also with the problems that are still ongoing, what is your next step for the hundreds of families, thousands of families still waiting on unemployment benefits?
So I was tested for COVID on Friday at the White House. So anytime you're going to be in earshot of the president, you do they have an Abbott Labs rapid test, which I know many people. I mean, I think we've tested probably 15% of the state of Florida. At this point, maybe even more. And so the typical test, they really jam. I mean, it's not comfortable what they do. The Abbott is a little less invasive, and they get the result in about 15 minutes, and so those are just kind of the standard things. In terms of the unemployment compensation, we've now paid out almost $12 billion, and I believe between 1.7 and 1.8 individual claimants, have now been paid, and I think that's like 99.9% of the folks that are eligible. So they're continuing to work on it. And that is more than the number of people that have actually been unemployed, because some of the federal benefit for the gig workers, does apply. So we've worked to do that, going forward, and we'll continue to do it.
Governor,
Sir.
You've talked a lot about protecting long-term care facilities. Here in Orange County, we've had some outbreaks at 3 facilities in just the last couple days. One, I think a little bit more than half the residents have tested positive. The other, a little bit less than half. One with 4 deaths at least. What would you say to the families who have residents there who are concerned that at least those facilities have gotten infiltrated?
Well, one, we've put more resources towards protecting our long-term care facilities than any state in the country from the very beginning. I mean, when we stopped the visitation in the middle of March, that was a tough decision because it leaves the families not being able to see their loved ones. We required all staff to wear PPE, and then we provided PPE. So the state of Florida has provided over 10 million masks. We've 500,000 face shields, gloves, gowns, to all the long-term care facilities for their staff to be able to do that in the hope that that will, help to limit transmission. They are required to be, all staff are required to be screened every day for fever, where you've been, who you've been with, and so those procedures are in place. I think they're followed, by most folks. We also, in April, I dispatched the National Guard to go around to these facilities, test residents who wanted to be tested, test staff. We were able to identify a number of infections before it spread, and so that was able to prevent larger outbreaks. After we went through that, we said, okay, if it's getting in, it's going to get in with the staff. And so that's why we have, and it's a big financial investment, but I think it's worth it. We're doing every 2 weeks, every staff member's got to be tested. And so if you identify somebody who has been positive, then obviously, they need to isolate and follow the symptom-based approach going back. So we've put in huge amounts of effort. I would say that because we've done that, we've had, given how many facilities we've had, I have no question that we've been able to save many, many lives. At the same time, this thing is a very insidious thing. I mean, you can have every precaution in the world, and there's just no guarantee. Now, some facilities, and I'm not saying those because I don't have all the details, we've had some facilities that have just dropped the ball. There's no doubt about that's happened. But I would say most facilities that have had a case have had a relatively limited number of cases that were identified and isolated appropriately. And that's part of the reason why we have these COVID-only facilities, because if you go in, say you have a staff and 2 residents test positive, you can take the residents and isolate them at these facilities. They can recover and then go back so they're not spreading it into the long-term care facilities. The other thing I think we're gonna do for families is the federal government is going to send, Vice President made this announcement yesterday, they're going to send point-of-care tests to many of the nursing homes. Now, we got to figure out how many in Florida and whatnot. But the point-of-care test, I believe they'll be the antigen point-of-care test. So it'll be a 15-minute test. If you have the ability to do that, then I think we need to be able to start thinking about visitation again. Because if you test negative, and then you can go in and see your loved one, and obviously you could have PPE requirements, all this other stuff. But I really, really worry about the toll that the isolation has had on people in long-term care facilities. Anything we do, any measure to combat the virus has second-order effects in other ways. And that goes with anything you can think of. And so this is one where I think it was the right decision. I think it has kept virus out than otherwise would have gone in. But it does come at a cost. And I think that folks really want to have that emotional and personal connection with their loved ones. And if there's ways we can do that, then we should do it. Now, we were entertaining opening up the visitation. I was thinking about proposals at the beginning of June. Well, our prevalence was very low then. I mean, we had under 5% positive in every part of the state, pretty much. Low hospital census, all that. As that changed, we had to put that on the back burner for now. But it is an important issue, and we want to get the family to have access to their loved ones.
Governor, the Orange County School District moved up their start date, at least for online for all students, to August 10th. They were still waiting on that waiver that they sent that would allow them to close the schools if they want to. Do you have any, do you think they're going to sign that waiver?
Well, I think that's something that's with the Commissioner of Education. I mean, he's really been the lead on this. What I just would say is I think that what's clear to me is that I think parents want to have the ability to control their kids' destiny and have a meaningful choice. And so for me, if parents believe that the distance learning is the way to go, if they're not comfortable in a face-to-face environment for their kid, then I think they have that right. But I do think there's a lot of parents who really do need their kid to have face-to-face interaction. And I think we got to do all we can to be able to provide that. Also thinking that if there are folks, instructors, teachers, who aren't comfortable being there, I know many want to be there, I think you can work that out and be very generous with folks who may not want to go there. But I do think I want to give flexibility because every area is different. And I do think by the time we get into the middle of August, I expect the Orange County trends to continue to be good. I think Brevard, I think a lot of the Central Florida has gone in a good direction. We want that to continue, and so I think that so I think that there's going to be a need for that. I think a lot of parents are going to want it, but I recognize that every district in the state of all 67. You're not going to have the same model apply in all 67. There's different epidemics you're dealing with in terms of where they are in the process. There's different, obviously, constituencies. There are some school districts where you have like 80% of the teachers, they want to get back. There's others where it's much more divided. Same with the parents. There's some where the parents are very much interested in face-to-face. There's others where the majority of parents say, we want to do distance. But I do think, though, it's important to know you hear some of the trends. Obviously, we got a lot more work to do, but I think people are doing the right things. I think we're going to continue to see some positive trends. At least that's my hope. And so I just think parents should just keep that in mind that, what was happening a week ago or 2 weeks ago, when we were seeing, this stuff really ramp up, we may be in a much different place, and it comes time to be in the middle or late of August. And I think that it's important to really keep that in mind. So he's looking at it. I haven't taken a look at it yet, but we are going to be. I'm going to start looking at some of these plans just to see what's going on and make sure we're doing right by these kids. When I mentioned the measures that we undertake, like the nursing homes, it's important, but it does come at a cost. And I think the distance learning, let's just be honest about the costs that are involved in that. You are absolutely going to have kids fall behind. You are absolutely going to have more kids drop out of school. You are absolutely going to have more problems in many other aspects of their lives. That's just what is going to happen. And so I just think we want to mitigate that as best we can and make sure that we're putting all of our students first, because it will be hard to recover from some of this if the kids aren't given the guidance. I think that is so important from so many of their teachers and folks who are involved in that. Thanks, guys. Appreciate it. I want to thank Advent. You guys are doing a great job. I know we got more work to do, but I think you've shown the way, and we're really pleased that Central Florida is making progress.
Thank you.
Appreciate it.
Trying to pull some more stuff.